Our focus has been on contact tracing, and particularly Serco, who have led on a lot of that work. This is not only because contact tracing is a really important example of public health teams having expertise and experience, but we think that Serco should be nowhere near our public services. Many of you on this call have already taken action. You have emailed your council leader asking them to reach out to Matt Hancock to call for the resources. You've also taken action in person outside town halls all across the country to say loud and clear that you don't want a penny more going to Serco. There were over 25 actions that happened from Sunderland to Bristol. That was Unite members, KOMP activists, and We Own It supporters as well. And it was absolutely brilliant. We have reason to believe that the contact tracing contracts are running on an 8-week basis. However, it's really hard to get the contracts. And so what we've realised is that we need to ramp up the pressure no matter what. We need to get Matt Hancock to listen, and he needs to give local public health teams and services the resources and the power to lead on test and trace. The media are reporting on this a huge amount, but now is the time to ramp up the pressure on the decision makers themselves and to show them that we know exactly why this is going wrong. So what's the call going to look like today? We're going to hear from some amazing speakers about why this fight is so important. Then we're going to have a bit of time for questions. So as Chris said, please feel free to pop those in. You are what's going to make this government take a U-turn. And we're really lucky to have you here today. So without further ado, I want to launch straight in and introduce our first speaker. So we're going to start with John today. John was the Northwest Regional Director of Public Health and Regional Medical Officer from 1993 to 2006. He is also the author of a brilliant book, Blinded by Corona, which is going to be published by Gibson Square Press on October 6th. And you can pre-order that from Foyles, Blackwell's, WH Smith, or Evil Amazon. We're going to share a link to the book right now, but I want to kick off and please tell us, John, why Test and Trace is failing us so badly. And please forgive me for cutting you off at 5 minutes because we...
No, thank you, Pascale, and thank you for inviting me. And I totally agree with all your wonderful introductory comments, and more power to your elbow, all you younger ones. Brings back memories of the campaigns I was involved in the 70s and 80s. I mean, the story is told in the book, and I you know, it sounds like self-promotion, but I've tried to bring the whole thing together from January through to the summer here to recount it, because it was coming thick and fast between that time about what was going on. And I think it's really important to have a narrative in one place where you can refer to and you can pick it all up and it's there. And I rehearse in the book about the way in which public health has been neglected by all parties, actually, since the Second World War. There was a period during the Blair years, one has to say, when it was taken seriously. We had the first Minister for Public Health in Tessa Jowell, with Sure Start and various other important initiatives tackling poverty and the root causes of ill health. But then things really went badly wrong again after the change of government in 2010. And of course, the economic crisis didn't help. And then the Lansley reforms of the health service really threw everything up in the air, created this agency called Public Health England, which over-centralised things and stood by while the local level of public health and the regional level was asset stripped. And it is that level that Pascale's already mentioned that was why this country had the reputation as a world leader in public health for nearly 200 years, and predating a lot of the science that we do now have. But when epidemics of cholera and typhoid and typhus and tuberculosis and so on depended on local knowledge and local people based in the town hall, rooting out the root causes, the slum housing and all of the things that predispose to infection, and dealing with that. What we've seen in this last 7 months or so has been a Prime Minister who's not up to the job. He's lazy, he's narcissistic, he's got no attention to detail, and he failed to get to grips with this when we could have still made a difference, even when we were behind the curve, because we'd allowed our local public health services to run down. And we've been running to catch up since, or not even running, stumbling is probably what's better to describe it, because it was clear to other countries that they needed to get the testing and tracing in. Tedros, the Director General of the World Health Organization, early on started to say test, 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 trace, isolate, and we weren't listening. We were watching other countries getting to grips with this, getting people to work from home, closing schools, doing the testing, wearing masks, all of these things. Meanwhile, our arrogant, complacent people in London, and including the advisors, were seeing things working in practice in other parts of the world, and then saying, no, they don't work in theory. And so we were too late to do so many of the things that needed doing. And then having been too late, doing too little too late, we then did too much too late. We saw what happened with the air transport. We saw the lockdown. It was unnecessary to lock down the whole country if we had had adequate testing and tracing. In that early period of the early weeks, the cases were predominantly in the ski-going classes of the home counties. They weren't in the poorer parts of the country. They weren't in the southwest. They weren't up the east coast in East Anglia and Suffolk in the northeast. They weren't in mid Wales. And we could have locked down cities and regions individually and controlled those if we'd had the testing capacity. The infatuation with the private sector is bizarre. The government has thrown billions at these lighthouse testing stations, which don't have the local knowledge of the different communities that we have, different language groups, faith groups, and so on, which our local public health directors and their teams have access to. They tried to run everything initially out of Colindale and the hospital in North London with one lab. They'd allowed other labs around the country to be run down and conglomerated so that laboratory services could be put out to tender for private sector contracts. That predated the Conservative government and the coalition. It had happened, from 2000 onward. It had happened. Putting together small services from small local hospitals, labs around the country that we needed to draw on. And the Germans did this when this started in Germany. They'd neglected their local public health system too. Germany is much spoken about as having the strong central institute of public health, but they had run down their local public health. What they did was they drafted in furloughed workers from other parts of the local authorities to work in the public health teams, to do the door knocking, to do the local contact tracing, and to do the support for people to self-isolating. Cuba is another good example of where they've done that and where they've gone to every household several times to check for cases and symptoms. The Isle of Man was in with us at the beginning. They got fed up with the turnaround times of the testing. They bought a second-hand PCR machine to do the tests on eBay, put it in Douglas Hospital and Noble's Hospital in Douglas, and they've done really, really well. Ceredigion in Wales, a district there where a science teacher the science teacher had become the chief exec, very practical man, took grip on it, did it all themselves. Ceredigion had really very few cases. We can do this, but we've got to change the way we go about it. The Prime Minister needs to put his hands up, admit he's got it wrong, and have a fresh start and decentralize the testing and tracing program.
Thank you so much, John. There were so many brilliant examples in there, and I think we all need to buy the book to see more of that brilliant detail.
There you go.
And we're going to just put the link in again in the chat. So without further ado, I'm now going to introduce Rachel Reeves. Rachel can't stay for the whole meeting. However, if you have any other questions, please forward them on to us and we'll forward them on to her team as well. You'll of course know that Rachel Reeves is the Shadow Chancellor and the Shadow Minister for the Cabinet Office. She's been an MP for Leeds West since 2010, and Rachel's been a leading voice within Labour on why the outsourcing of the coronavirus response has been so harmful for our communities. So Rachel, if you're up for it, we'd love to hear from you. Thanks.
Great. Well, thanks so much, Pascale, and it's a real pleasure to follow John there and that powerful speech. And John used that word infatuation. The government are infatuated with these outsourcing companies, and with outsourcing being the solution to every problem, when we all know, and that's why we're on the call this evening, that that is far from the truth and far from reality. The problem with outsourcing these contracts is that outsourcing companies have a different motivation to public service. Their motivation is profit maximisation. It is not to deliver the best public services for those who need them. And we all pay the price for that with poorer services. And I'll come on to that in a bit more in relation to the coronavirus crisis. But the other people who lose out are the people who work in those public services. And through the TUC and trade unions, I've been meeting with workers who work in public service but now work for private companies, and they talk about their wages and their terms and conditions being degraded and devalued as the search for profit overrides everything, including the quality of service, but also the treatment of the staff who deliver those public services. And that's why I think this is so important. And that's also why it makes me so angry to see what we've been seeing during this crisis, when many of us have been warning for a long time about the perils of outsourcing. In the last Parliament, I chaired the Business, Energy and Industrial Strategy Select Committee, and I led the inquiry into the collapse of Carillion. And for days on end, we took evidence from the executives of Carillion, who were earning huge salaries with massive bonuses, who oversaw the collapse of that company. And the people who paid the price were not the people giving evidence to our committee, because they all walked away with their bonuses intact, but instead the people who were expecting hospitals to be built in Liverpool and in Sandwell, people who worked for those companies who no longer had a job, subcontractors who hadn't been paid for months and months by Carillion, and people saving for their pensions who suddenly found they were worth less than they were before. And who picks up the bill? Well, we all do as taxpayers, because in the end, you can't outsource risk when it comes to public services. And so that delusion that outsourcing means better value for money for taxpayers is just a fallacy, because it is always the taxpayer and government who ends up picking up the bill for when these services fail. So you outsource the profit, but you can never outsource the risk of public services. What we've seen during this crisis, as I said at the beginning, and as John has eloquently put it, that the government's infatuation with outsourcing has come to the fore. And we saw it with testing, and now we see it with tracing. With testing, there's one story which I think highlights the problem that we face. Deloitte, who got the contract for testing centres, did not have it in their contract that they had to share information about who had tested positive for the virus with local directors of public health and local authorities. And that meant it was almost impossible to keep track of who was becoming ill and what communities were particularly affected. And that was a massive problem at the start of the crisis, and when we had to start introducing, the government had to start introducing local lockdowns. Now, if testing had been run by the NHS or local authorities, you wouldn't have needed a line in the contract and additional profit to get that information to be shared, because it would have been part of the fabric of our communities and the fabric of our local and national government. But by outsourcing it, it meant you had to pay more for things that would just be delivered as a matter of course in the public sector. And we see the same problems with the outsourcing of the tracing system. You've got call centres who are totally divorced from the communities in which they are talking to people. And so you've got people who have never been to a town or a city or a village giving advice and trying to understand the spread of the virus, and it's not working. In some of our poorest communities, the contact tracing has only reached just over 50% of the people whose details have been handed over. And that is one of the reasons why this virus is now endemic in some of the poorest communities in our country. And all the time, Serco and the 29 subcontractors that Serco are using to deliver, and I use that in the loosest sense of the word, the tracing system, are all earning a profit, while it's not succeeding in either getting a grip of the virus or contacting all the people who need to be contacted. And in Oldham, because it's not working, the local authority there has had to recruit volunteers to go door to door to contact people who might have come into contact with the virus. Those volunteers are not being paid, the local authority is not being paid, but it's the only way for some of our poorest communities to get a grip of the virus. And so that's why I'm calling, and Labour are calling, for this to end. This infatuation with public outsourcing is wrong. It's not delivering. It is eroding the wages and terms and conditions of public service workers, and it is resulting in a worse service for all of us, which is affecting, during this virus, all of our health and well-being. So I'm urging, and I know that everybody on this call will join me in urging the government to think again, to bring these services back in-house, to ensure that we have a system that is fit for purpose, so we can get grip of this virus, protect our communities, protect our health, and protect jobs as well. Thank you.
That was absolutely brilliant. Thanks so much, Rachel. I know you've got other calls to join this evening, so if that's okay, if there are follow-up questions, we'd love to send them on to you, but it's really brilliant.
I'll stay for another, Pascale, I'll stay until about 10 past, but then I have got to go on to something else. So I'll stay for a little bit longer and listen to others.
Okay, brilliant. Thank you so much. And it's brilliant to have Labour support. Thank you. In keeping to time, I would now want to introduce Louise Irvine. Louise is a GP in South London, a health campaigner and a parliamentary candidate. She's the chair of the Save Lewisham Hospital campaign, which was successful in saving the local hospital, and she's secretary of Health Campaigns Together, which is an umbrella organisation for many local and national NHS campaigns. Louise is a member of the Council of the British Medical Association and Secretary of Doctors in Unite. So she's also launched the new campaign around testing, which we will share a link to again in the chat, and we're lucky to have her today as well. Louise, if you could take us in 5 minutes on why we should be bringing testing back in-house, that would be amazing.
Well, thank you very much, Pascale, for inviting me to speak here. And actually, I don't think I've got anything, I don't want to take time repeating what the great things that John Ashton and Rachel Reeves said, because it's absolutely, right what they were saying. And it's crucial now that we have an effective test, trace, isolate and support system, because we are facing a second wave of the coronavirus. We're going to hear some announcements tomorrow from the government about what they think they're going to do, but nothing is going to be effective unless you have this core service, you get it right, because it is basic public health. It's the basic public health means of controlling every epidemic since the beginning of public health, which is you identify the cases, you isolate them, and you help to break the spread of the transmission of the virus. And I think isolate and support are two important parts. What's the point of testing? There's no point in endlessly testing people unless you know what to do with those results, unless you can get the results quickly, which means being able to test people promptly, get the results quickly to the right place, to people who can actually support those people who turn out to be positive. For example, GPs like myself, we need to have those results, but local authorities need those results quickly so they can identify clusters of outbreaks and actually act swiftly. But you won't get people to isolate for 2 weeks unless you support them. There are many people who don't get paid if they don't go to work. So the government has to have an emergency fund to ensure they maintain the income of anybody who has to self-isolate. It's basic. Otherwise, people won't come forward for tests and they won't name their contacts and the whole system will fail. So I think supporting people to isolate is a crucial part of the whole system. The whole thing works as a kind of wraparound. Every bit of it is equally important. And it has as John outlined, it's completely failed. At the time when other countries were stepping up their testing and the WHO was saying test, 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 our government in March stopped testing. It was really frustrating for GPs and health workers like myself, because we couldn't test our patients, and we couldn't test ourselves or our colleagues to see if we had it, as if people were taking time off work, which they may not have needed to, and we couldn't really advise our patients properly. And even when they set up these hot hubs, I'm in Lewisham, but they happened around the country, where you had a place in the community that people who were the fever, who were ill came and could be assessed by health staff. Those staff couldn't test those patients. It's ridiculous. And now we've been endlessly promised all kinds of things like the world-beating app that sunk without trace. And now we've got a hugely privatized test and trace system. And I can't emphasize it enough, but it's already been said, it's a parallel system with very few contacts and very little communication with the people on the ground who are actually providing healthcare, or the local public health people who are actually trying to get on top of the outbreaks locally. It's the most bizarre thing to do, and shows just how much this government is hell-bent on promoting its ideology, which is to favour the private sector, not only by passing huge amounts of money over to their chums, but even more worryingly, embedding private provision as a central part of healthcare provision, to the extent that we'll have an almost privatized laboratory system before long. And it isn't working. So our critique of this is not just ideological, it's actually practical. It's not working, and we need it to work. I suffered terribly, my family suffered terribly from the last coronavirus wave. My husband was very ill, he was in hospital, he nearly had to be ventilated. My father died, and my mother was also in hospital with it, but she survived. I say that because I think we can get a bit abstract sometimes talking about these things, and it is a really very real threat to people in our society that a second wave could come. So it's of crucial importance, burning importance, that we do everything we can to campaign to force this government to change its policy and to shift the whole responsibility onto the NHS and public health, and commandeer all those other resources like the Lighthouse Labs and everything, have it under one public authority that can actually make sure it's locally embedded, which is how it's going to work. Now, this seems like a tall order, but this government has made endless U-turns. It is vulnerable to pressure, and we do need to do everything we can to pile on the pressure. And Keep Our NHS Public has worked really well with We Own It, and is delighted to do that, because I think the more we come together as allies with all of our different campaigns, the better. Keep Our NHS Public just launched a petition on change.org just 2 days ago, and it's now got nearly 150,000 signatures to bring the whole test and trace system into public hands. And I think we should be doing, signing the petition, writing to our MPs, getting involved in the different campaigns that We Own It and Keep Our NHS Public are doing. But also, I know that there's quite a lot of local campaigns, and maybe we'll hear from somebody who's been doing some local pressure on talk to your public health people locally, talk to your labs locally, say, why can't we do this? You should be joining us to put pressure on the government. We need a U-turn, and we desperately need it now. Thank you.
Oh, that was absolutely brilliant. Thank you so much, Louise. We are going to move quickly on to Allyson Pollock. Allyson doesn't need much of an introduction, but I will attempt to give one. Allyson is a clinical professor of public health and co-director of Newcastle University Centre for Excellence in Regulatory Science. She's also a member of Independent Sage and the author of NHS PLC and co-author of the New NHS, A Guide. She was co-writer of the Reinstatement Bill, which aims to reinstate our NHS as a public service, and she's president of the Socialist Health Association. She's also a founding member of Keep Our NHS Public, and we're very lucky to have her here today. So Allyson, thanks so much, and take it away.
Thanks very much. Thank you all for coming and for listening. And thanks to John, Rachel and Louise. I'm not going to cover any of the ground that they're covering, I hope. I suppose I've got two things to say. One is, we're not entirely sure. We don't think we're in a second wave. And there's quite a lot of hysteria and panic being created about this. It's much more likely we're still in the continuation of the first wave, and that the cities that are being affected most at the moment may well be the ones which had less infection. If you look at Spain, you can see the regional prevalence, and also in our country, how that changes. So I was very disappointed in Patrick Vallance's presentation today, and the slide which he said was not predicted but is being used widely as projected hospital admissions and fatalities. And I think we've got a lot of diversionary tactics going on, which is about creating fear and panic and divisiveness in the population, and it diverts away from what we've heard tonight, the fundamental failures of the government in respect of primary care, testing and laboratories, and public health. So I think it's very important that we are not divided as communities, with old blaming young and old blaming travellers and people doing this and that. I think we the public have been extraordinary and made extraordinary sacrifices in 7 months. And the reason why we're going into this catastrophic, these so-called lockdown situations, which are removing our civil liberties, and that's really important to remember, is because the government still hasn't got test and trace working. But the second, and I think not that everything isn't lost at this stage at all. There's a lot of immunity, more than likely, in the population. And so we're not where we were in March. But nevertheless, we are where we were in terms of the abysmal, chaotic delivery of services. And now we've spent billions, hundreds of billions, millions of pounds, in fact, billions of pounds we've spent, squandered, when we could have had an opportunity to rebuild public services. I don't know if you can all hear me, I hope so. My internet isn't great. But what I want to go on to next is, let's not get too hung up on testing. Testing is important, but as you've heard from Louise, it's important when it's linked to a clinical diagnosis. Because the tests that we have are not tests that tell you who is infected and who is infectious. They're tests of pieces of RNA that can be in people who've got live virus and are infectious, but they can also be in people who've had past infection. So it's very important when you're making a clinical diagnosis that you link the test results to the symptoms. And this is one of the big mistakes that the government did, was to remove the tests and the testing system from our NHS and out of the purview of general practice. There is no other test apart from the pregnancy test that I can think of that you can go and self-refer and self-order without having a health professional or a clinician referring you and then interpreting the tests with you together. And this has been a disaster, because as a result, we do not know of those who've been tested, whether they were asymptomatic, test positive and infectious, whether they were asymptomatic and have had lots of infection in the past, but not infectious anymore, but testing positive, and those who are truly test positive and infectious. So this has been a really big issue. And it will get much worse the more random testing that we do. And under the government's proposal for Operation Moonshot, which is to test the whole population frequently using mass testing. Mass testing is nothing else but screening, and screening is difficult and complex and got lots of ethical issues. So we do need tests, and we do need people to access tests, but we need gatekeepers to those tests, and traditionally they've been primary care and health professionals. So that's the first thing that needs to happen, is that the testing system, as Louise and John and Rachel are saying, needs to be put back into the NHS, and it needs to be part of primary care, NHS 1.1, and local GPs need to say, how they're going to organise it. Because now what we're seeing is lots of people who've got flu, colds, coughs, upper respiratory tract infections, and they all think they've got COVID. So they're all trying to get tests, of course. And most of those tests still, over 95%, are still negative. So we've got huge waste going on in the system as well, with people having tests that don't need them because they've not been screened out by health professionals. Now, GPs understand the difference between a cold, a cough, an upper respiratory tract infection in a child and an adult from actually COVID symptoms. So I think this is a really important issue. The second issue, of course, is GPs in England have not been able to order tests, and this is diabolical. They can now in Scotland, but they weren't able to, and that needs to change. The third issue, as you've heard, is that the NHS, instead of putting the capacity into NHS laboratories, we've had public-private partnerships with lighthouse labs and commercial testing, where the quality and validity of the tests isn't always as we would like it to be. We do not know whether people are having confirmatory tests. So there is a real issue, and you're right, the lighthouse labs were only a temporary phenomenon. They should be disbanded and the resources put back into and building up NHS. And of course, as John and Rachel have said, we need good, I don't know if I've meant to finish now, but we do need local public health. Health protection and communicable disease control was carved out of local authorities and the NHS, and it sits with Public Health England. It needs to be reintegrated, and we need an Act of Parliament that will reintegrate and reinstate our NHS. Don't forget, we've actually lost it. It's hugely fragmented in England. But there are some very simple things that the government can do now and get it right. One is find the symptomatic people. 2 is test them within the NHS. 3 is contact tracing and get the contacts. And 4 is isolation and support. But the idea that you can bring in punitive fines of up to 10,000, this is going to be a real turn-off for people on low incomes, people on zero-hour contracts, people who can't afford it, and most people will no longer be giving the details of their contacts, and they may not well be coming forward with symptoms because they'll be too frightened of the consequences. I think this is quite an extraordinary move of the government to make this both legally binding with huge fines and sanctions, and not to think about the real support that people need and protection to self-isolate. So I will stop there because I think it's important to open up the debate. But remember, testing has to be really carefully thought about. It should be linked to clinical diagnosis and symptoms. Screening and mass testing of asymptomatic people generates new problems, not just of false negatives, but false positives. And it has to be thought about very carefully when we're targeting it at nursing homes and home care workers. And this idea that every school and every university should be clamoring for testing is a nonsense. It's not evaluated, and it has a lot of potential danger. So let's go back to the very basics of public health, and this government then could make a lot of progress between now and December. Thank you.
Thank you so much, Allyson. That was absolutely brilliant. There's message after message of people thanking you for these really brilliant contributions. Thank you to all of our speakers. We've got a bit of time for questions now, which Chris is going to lead. He's been hand selecting some of your questions, so I'll pass over to Chris now.
Brilliant. Thank you so much, Pascale. And thank you to all of our phenomenal speakers for their contributions, which were incredibly helpful and stimulating. And thank you also to everybody's comments and questions in the chat so far. If you have any further questions, please do pop them in the chat and we'll try and pick the best ones for our speakers. So the first question I'm going to come to it's kind of more of a political question than a medical question. It's something that's been coming up quite a lot in the chat so far. And basically it's that throughout this pandemic we've seen a theme of essentially the government giving contracts or jobs to people or companies that have very little experience in the way, or no experience in the way of public health, whether it's, Deloitte, an accountancy firm, being given a role in testing centres, or the rest of the outsourcing package as well, or indeed Dido Harding's role at the helm of the test and trace system, and now in the new replacement of Public Health England. So the question kind of coming in from a huge number of people is, why are the government sort of hell-bent on giving contracts and jobs to people and companies that clearly have no experience and background in this area? So I'll go in the order that we started with. So I'll bring in John first, if that's okay.
Well, it's a combination of naivety and fanatical ideology and democracy. It's the three things. I mean, sadly, it was my experience when I was regional medical officer in the Northwest, that you're dealing with ministers, and the only one who really understood properly public health was Tessa Jowell. New MPs don't have very good induction into the specialist areas, and they don't really understand it. They don't get public health. So you've got ignorance to start with, but then you've got ideology and this fanatical belief that the private sector can do everything better than the public sector, in contradiction to the evidence. And we've seen how the railways have basically been renationalised now by default, because they can't run a private railway in a circumstance like this. So, and then the democracy, which actually spills over to the government advisors in this. Most of these government advisors around SAGE all know each other. Most of them are from Imperial College, University College, Oxford and Cambridge, and a bit of the London School of Hygiene. There's very few of them outside the M25. They don't represent the country. They're largely male, and they all know each other and have worked with each other in the past. And this is a country of 60 million people and huge amount of intellectual capital, but we don't draw on it. It's a tragedy.
Thanks, John. That's incredibly useful. Louise, I'm going to bring you in if there's anything you wish to add to that.
Not really. I would just concur with that. It's a deeply ideological. I mean, the current government does not value the public sector at all. It doesn't believe that the public sector has anything positive about it. But this coronavirus issue actually illustrates par excellence why we need a public sector to provide for this. So we can make the arguments just generally about the importance of putting things into the public sector again. But it's profoundly ideological, and that's why they're so resistant to it.
Thanks, Louise. And then finally, Allyson, is there anything you wish to bring in on that? I think you're on mute, Allyson, sorry.
No, I'll take a different question. I think the others have answered well.
Great. Well, I'll bring you in first on the second one I've got here then, which is specifically around data and the kind of the way that data, the role of data in the kind of prioritisation of the pandemic response. And it's something that wasn't kind of picked up hugely in your introductions, but it's a really big issue, and Open Democracy in particular and others have been doing a lot of work to expose kind of the way that our data is being outsourced as part of and privatized and as part of the wider privatization of the pandemic response. So obviously you have companies, the companies that are directly involved in the contact tracing that are implicated in that, but also you've got companies like Palantir who have been giving contracts, and Google and Microsoft and others. So I wondered if you could touch a little bit about the role of kind of the privatization of data as part of the pandemic response and the track and trace system.
Oh my goodness, that's a huge question. Absolutely enormous. I mean, there are so many different elements. I mean, the first element is, are we collecting the right data? And is it understandable and interpretable? And the big issue with the test data is it isn't, because as I've said, we don't disaggregate. It's collected by the tests are done by commercial companies. And we have no idea whether people presenting are symptomatic or asymptomatic or the reasons. So that's not very helpful when you think you might have another little spike, another little wave. Well, it's the same wave probably taking place, but we don't know whether it's more, the more you test positive as a proportion, or whether we do have an increase in cases, but we don't quite know what's going on. Now, the second part of the question is about who owns the data and where is it going? And I think that's a really serious question. We have the creation of the Joint Biosecurity Centre, and we also have NHSX. And as your speakers referred to, we've got Palantir and faculty who've got, Palantir has a record in the US. And I think there is a real issue about data governance, data controls, who the data is being shared with and why and how, especially if we're going to have punitive fines going for not isolating exactly who's going to be imposing those fines, who's going to be chasing them, and are our NHS data going to be shared with the Home Office? So I can't give you a comprehensive answer now, but it's a really important question and a really important issue as we move into the surveillance state. And it might yet be another reason why people don't give their contacts. It was certainly a huge issue with the app in England. So I'll just stop. I won't give you any more.
Great, thanks, Alison. That's incredibly helpful. John, was there anything you wanted to add on that?
For me?
Yeah.
No, not really. I just think it's misuse of public funds. And because they're incompetent, it raises the issue of what Engels called social murder, because people are being killed by negligence.
Thanks, John. And Louise, do you want to come in on that as well?
Just a quick thing to add is that, collecting data to help promote healthcare and public health is really, really crucial. But people don't trust the government, quite rightly, because of how they're using the data, and it's going into private hands. And it means that we're actually in danger of not having the kind of data we need in order to help to promote the public health. So it has a particularly negative effect on public health, this approach that they're taking.
Brilliant, thank you for that. So I've had a huge number of questions coming in about how do we campaign against all of these different battlegrounds around outsourcing and privatisation. And luckily, towards the end of this call, I'm going to pass back to Pascale, who's going to give you a very clear next step that you can take for that. But before I do, I wanted to squeeze in at least one more question. And basically, this has come through from a number of different people, and it's about the test and trace systems that are being set up by local authorities now in place of the national system, the national privatised system. To what extent do you think that's part of the solution if national government won't deliver an effective test, track and trace system, and they're obsessed with this with doggedly sticking to the private model? To what extent do you think that, at least from the contact tracing side, that local authorities stepping in and running it themselves in lieu of government action is going to get the kind of system that we need? And I'll bring in Louise first on that, if that's okay.
Yeah, I think it's a great idea. Not because I think that I think it's the responsibility of the government to organise and fund this, because it is actually hugely costly. So I wouldn't want it to be a kind of to become the do-it-yourself test and trace, but to become the norm. But as an example of what can be done locally, and as an illustration and a point to campaign around, I think it's very, very powerful. We mobilize people. You can say, we're doing it, and it's, we can do it, but we need the resources. You need to fund us to do it, and you need to organize it nationally. So as part of a broader campaign, I think it's a really good idea.
Brilliant, thanks, Louise. I'm going to bring John in on this next, if that's okay.
Well, I mean, this is what has to be the way forward. And we've seen in the north of the Netherlands how they took control for themselves there in total conflict with the national Dutch government, and organised through medical students, volunteers, nurses, everybody to do it. And I think this is about taking the moral high ground. Somebody's just flagged up about all the volunteers that came forward earlier in the pandemic. We can mobilize our own communities to do this. And then we have to send the bill to Whitehall, because we have to do this from the bottom up. It can't work from the top down. And there needs to be legal action brought against the government for misuse of public funds with these contracts that haven't been properly procured.
Thanks, John. And I'm going to give Allyson the last word on this question, if there's anything you want to add.
Well, just that local authorities are already cash strapped, so they absolutely should not be funding this out of their own resources. And the government should be giving local authorities resources and building up the resources in local authorities with the Public Health England health protection teams. There are 21 of those, and they're working very, very well together. So that's where the effort should be focusing on Public Health England, the health protection teams working together with local authorities, public health departments, and actually putting back communicable disease control. It does need to be there in local authorities, and it really should have been there. The proper officers are not there, they're in these health protection teams, but we also need to rebuild the capacity and make sure that that goes back into the local authority as part of the National Health Service as well. Okay, I'll stop there.
Brilliant, thanks, Allyson. And so Pascale initially told me that we had until 20 past for questions, and I'm seeing the clock and it's 7:23. So unfortunately, I'm going to sort of wrap those questions up now, but I know that a huge number of you wanted to know what we do next in terms of the fight against privatisation and the fight for a publicly run, safe, effective test, track and trace system. And luckily, Pascale has the answers for you on that. So I'm going to pass back to Pascale now. And one final thank you to all of our incredible speakers and for their really thoughtful and intelligent and stimulating responses to your questions. And of course, thank you to everyone on the call.